Yes, I'm so excited. For me, I'm even just glad that we're in a whole new season.
Yeah.
And I'm imagining behind the scenes all of the steps you've taken that have brought you here. I want to believe that your organization is in a healthy place or a healthier place. I also want to believe that some of you who were teetering, with the decision whether or not to start an NGO have either decided to start or are volunteering on existing programs of other organizations. Hello and welcome to Impact Bureau, a unique podcast brought to you by Mayan Organization. Impact Bureau is designed for NGO leaders, executives, founders, members, and trustees. Think of us on Impact Bureau as your unincorporated trustees who give you real advice that you wish your real board coulda, woulda, shoulda.
Hello, our
Hi!
Impact Bureau community.
Yay! I hope you like the new name we've given you. So just because of your dedication and your loyalty to catching all our episodes, you have a whole new label ascribed to you. Impact Bureau Community. I think it's a great
Yes,
name.
if you ask me.
Yes, it is. So welcome to a fresh episode of Impact Bureau. My name is still Adam and I have the delectable.
Moturayo.
Yes.
So feel free to call us ED and Mo.
Yes, Edie and Mo. And so Edie and Mo are back in your faces again with another exciting. Oh, by the way, this is a whole new season. Fresh season. So we wrapped up our first ever season of Impact Bureau with 7 amazing episodes,
Yes.
which, started you out on running your organization. We're going into season 2 with this episode today, and we're digging deeper into some of the nitty gritties of running your organization. I'm so glad to have you still loyal and connected to Impact Bureau. We should do a test. We should do a test, a short quiz to see
Yes,
how
we
well you've
should,
implemented some of the things
Mhm.
that we've taught you. So I know, we know what we'll do. We'll create a whole, Q&A section in the comment section of Impact Bureau. Please feel free to send us your testimonials, your challenges, your victories also in the journey to, implementing a lot of things we shared in season 1.
Yeah. Guess
Welcome.
what? This season is going to be focused on people, both internal and external. So
Yes.
it's going to be a whole new discussion altogether. So specifically, the topic for today's discussion is ideation processes for programs. Edie, are you excited to jump on this?
Yes, 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 yes. I'm so excited. For me, I'm even just glad that we're in a whole new season.
Yeah.
And I'm imagining behind the scenes all of the steps you've taken that have brought you here. I want to believe that your organization is in a healthy place or a healthier place. I also want to believe that some of you who were teetering, with the decision whether or not to start an NGO have either decided to start or are volunteering on existing programs of other organizations. So whatever label, whatever your grouping is, this episode is going to be very relevant for you because we're now delving into the heart, the kernel of what you do as an organization, and that is programs. Programs, programs, programs.
Yeah. So my first question would be, what's the nature of programs? When we say program, what does that mean?
Yeah,
Basically?
yeah. And thank you. It is a very important question. Organizations have offerings, that they present to the world. A typical company has a product or a service, right? Organizations like ours, we call what we provide to the world programs. Sometimes we call them projects. These are our own sets of measures and activities that are aiming at specific objectives. Our programs are solutions to the problems that we have seen around us and the very reason that led us to set up the organization in the first place, right? So they are essentially solutions, a nature of solutions, that are deployed in very specific ways to tackle existing development challenges. The simplest way, like I said, to describe them are sets of measures or sets of activities. When we implement these sets of measures / these sets of activities, we're rolling out basically a program in a specific area. And our expectation is that the outcome would be some transformation one way or the other. So that's
Okay.
it.
So let's say that. Can you give like a scenario or like an example that helps someone understand how what they should be thinking about when they are designing programs?
Okay, so your question is essentially, so we've understood what a program is. So the next thing is, what should guide my designing of a program, right? Again, I always like to say you work your way backwards from the end to the beginning.
Okay.
Remember, in the previous episodes, and if you haven't watched season one, this is an
Opportunity to go back
or
to,
yes,
yeah,
a call for action for
yeah,
you to go back to do it. Because in one of those episodes, we talked about you starting out with your strategic plan, right? And we said the whole, what do you call it? Starting point is that problem in the world that inspired you to do something about it. So the vision you then come up with is basically what the world looks like when that problem has been solved or when that problem no longer exists. Similarly for programs, what you should be thinking about is that problem. What is that problem that exists in your context, whether it's your community context, whether it's your, societal context or national or subnational, that is a state context, or even regional. Some organizations are established to do impact at a regional level. You're going beyond the country to work in multiple countries, perhaps in West Africa or East Africa, or you're covering the entire African continent. Now, there is a specific problem. You don't want it to exist anymore. So you need to, first of all, have a problem statement. And by that problem statement, what you should be thinking about as a founder or as a program leader is you need to understand fully that problem statement. In fact, in a typical grant proposal, they would ask you to, first of all, describe the problem. What is the problem statement? For that takes you into a proper, context analysis. You're going into the context of this problem. What is the historical, what's the roots of this problem? How long has it existed? What,
who is most affected?
yes, who are the people affected by this problem? What are the effects or what, what are the natural consequences? What does this problem result into in terms of lives and conditions, right? So these are things that you would cover in a problem statement. The next thing you would naturally have on, at the back of your mind would be, so I now understand this problem. I'd like to see some, perhaps maybe like a background in terms of what activities or what interventions have gone into this addressing this problem so far before now. Remember, we're trying to identify what program we should implement that will result in reasonable expected transformation. To do that, you need to know what has been done in the past. What measures, similar or different from what you're thinking around, have been implemented in the aspect of this problem so far? What were the results of those interventions? What are the persistent gaps? So maybe people have attempted to address this issue of a rising number of out of school children. Perhaps look at Nigeria. Despite interventions, Nigeria's out of school children population has grown from the 11 point something million it was in 2012 to over 20 million right now. We are the nation with the second largest population of out of school children in the world, second to India. So you want to find out, okay, what's causing this? We've done all that. The root causes, okay, poverty, okay, gender, maybe sociocultural norms, maybe infrastructural deficits, whatnot. So these are issues around the problem statement. You then want to know, what's the what have people done in the past? Okay, the government has rolled out measures to do, school infrastructure, build classrooms, expand the number of schools. There have been efforts by civil society to do a lot of sociocultural, campaigns at community level, campaigns to tackle gender inequality, stereotypes around girls' education. There have been efforts to support, indigent families, children with, scholarships, school vouchers, and the likes. And still the number is persisting. So you want to find out, okay, if this has happened, what results did they achieve? Did they actually stem or arrest the number of children who are not in school? In what ways? Maybe some measures increased enrollment, but were there measures that reduce dropout factors? What is it? Maybe you've decided, okay, I noticed that with the measures of the government to build, expand school classrooms, infrastructure, blah, 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 enrollment increased. But at the level of secondary school or maybe post-primary, there was no measure in place to prevent dropouts. And so factors were influencing early, child marriages, teenage pregnancies, and this is now causing many of the children who were once enrolled to drop out. That's affected. So you then decide, okay, this information should guide me as to where to tailor my intervention. So these are the kinds of things that you should be thinking about before you narrow yourself to a specific program activity or a specific set of measures. You must come from a place of a deep examination of the problem, a deep understanding of what measures have been introduced to avert that problem in the past, to what degree were these measures successful, what prevented the levels of success, what are the gaps that persist, and which of these gaps, persistent gaps, can I best respond to? Then you then say, based on the information, again, what you should be thinking about doing is sitting in a room with some representatives from Kakanfo, mothers of children in Kakanfo, community leaders in Kakanfo, be as participatory as possible. Representatives of these communities who can give you insights, so that the reason why you're bringing them is you want to know, why is malaria persisting? What is happening in Kakanfo that is resulting in so many deaths of children below the age of 5, and these deaths are attributed to malaria? Bring in health experts, professionals. They can also give you their own insights. And so, or either you bring them to one convening and you hold a stakeholder sort of, summit or some sort of stakeholder consultation process, or you go to these groups through surveys, through, some channels for data collection, and you want to find out something. Yes, you're generally trying to get information that will guide your interventions. When you do all that, you also, as much as possible, can do the research if there's available administrative records from government departments, ministries of health in these states you're residing in. Yes. Or if you can even check on the internet, some researchers and academics may have done research, public health experts may have done research in these areas. This will also give you information, sufficient information. Get as much, paper publications, whatever data source that can guide you, so that you are trying to zoom in on the issues. Perhaps you may then discover that, chief in the list of the drivers of these deaths or these problems, from all my interactions, from my research, from my inquiries, it seems to me that one, issues of sanitation may be a contributor or a major factor in this incidence of malaria affecting children. Perhaps, yes,
leading to the problem
has been identified. Maybe the community people tell you that we don't have enough clean water, pipe-borne water, running taps, so there's no clean water to clean our drainages, clean our gutters, so there's a lot of stagnant water in the community.
All right, Edie, so now that we've identified the niche,
okay,
using another illustration, can you explain what the next step should be?
Okay. So basically, with the first illustration I gave, it has helped the founder to identify that persistent gap that he or she wants to narrow their intervention or specifically tailor their intervention towards, right? Their measures. So you've asked me to use another illustration. Let me give an example of malaria in children, or child mortality, right? So an organization or a founder could have established an organization to address child mortality in Nigeria. And with the analysis of the context, the problem, or whatnot, this founder who's listening to me now may have identified issues of malaria as a major driver of child mortality in his or her community, right? That person then says, with all that I've discovered, it seems to me that with all the measures that have been historically carried out to prevent children from dying before the age of 5, measures in malaria have not really, in addressing or tackling malaria, have not really been as effective as they should be, or there have not been sufficient measures in my community to tackle this aspect of malaria in children. I therefore want to, address through a specific set of measures and activities this issue of malaria in children, which causes child mortality, that is, children dying before the age of 5. So now, what am I going to do? Remember, you're seeing the logic that has brought you here. You looked at the context of your community. There's been a lot of heavy incidents of child mortality. That's the problem. part of the problem when you identified or examined was that malaria is a major driver of the deaths that are being recorded in children below 5. Another analysis told you that not enough measures have been carried out in the area of, on the aspect of malaria. That's why you then decided to focus your measures or your specific programs on that gap. What then should you be thinking about now? Since you want to address malaria, I mean, come up with a name, right? You need to have, even for yourself, some sort of heading, a label that tells you, okay, so I am focused on the eradication of malaria in children below the age of 5 in Kakanfo community of Oyo State, Nigeria. So that's, a very clear direction. Anybody hearing that knows the objective of that, right? Then you then say, based on the information, again, what you should be thinking about doing is sitting in a room with some representatives from Kakanfo, mothers of children. You may also have discovered from your inquiries that, and maybe mothers will tell you that, we don't have treated mosquito nets. We don't have, mosquito repellents. We don't have mosquito nets to protect our babies, to protect our infants, to protect our children. So you identify also that it looks like in many of the households in Kakanfo community, children are not sleeping under the protection of mosquito treated nets, right? Then you might also discover that in terms of even levels of information and knowledge, families don't know how to keep their environments clean. They're not cutting the grass. They're not making sure that they don't allow stagnant water exist around them. So maybe there's some level of lack of information and knowledge that's also contributing to the high incidence of malaria in these communities. You might also, have identified so all of these things might then
Maybe
guide
there are no
you.
healthcare facilities
Yes,
nearby.
or maybe yes.
Maybe there is, but there is resistance on the part of the community.
Maybe they're not even
members to
visiting the hospitals, right? Maybe they are using our traditional tribal medicine, and so they're not taking these children for the diagnosis.
Yeah.
They're not
Or
testing
maybe they don't
them.
even give back to them in the health center facility.
Yes, but but since we are working on malaria, so let's not even go into delivery and all of those are other contributors to child mortality.
Yeah.
But remember, the focus now is on malaria. This person has identified malaria as their own gap that they want to address. So they are not families. They may have identified that families, even when children present with symptoms of illnesses, don't go to primary healthcare centers where they can be tested, where they can get, a diagnosis and immediate prescriptions to treat malaria. So all of these factors will then let this founder then say, okay, which of these, in this compilation or in this list of root causes or drivers of this problem, which ones can I reasonably, or how can I tailor a set of measures around these problems? And so this might lead you, the founder, to then say, okay, I'm hearing three things. One, I'm hearing issues of lack of mosquito treated nets. Second, I'm hearing issues of lack of relevant information to guide households, to guide parents and guardians on how to handle these, health issues, whether it is preventing illness, malaria illness, or when malaria presents, whether it is treating it. And also, thirdly, I'm also hearing the issue of, an infrastructural problem. There's not sufficient, access to running water that keeps the environment clean. Gutters are, not cleaned up. A lot of stagnant water exists in these communities. So based on this information I've gathered, I can do three things to eradicate malaria in these communities. I can consistently distribute mosquito-treated nets to households. I can consistently conduct information and enlightenment campaigns to educate households, families, parents on how best to prevent malaria, and once malaria is detected, or how to quickly detect it and treat it. I can also do advocacy to government policy makers, decision makers at that level to say prioritize 1, 2, 3 things. Ensure primary healthcare centers, have children's wards. Children's wards, must have mosquito treated nets. There must be available beds. Also, the radio programs must exist on the issue of enlightening families around malaria prevention. And these are policy related issues. So if I do these three things, distribution of nets, enlightenment to families and households, and also advocacy, I will reasonably reduce the incidence of malaria affecting children below 5 and thereby prevent child mortality in Kakanfo community.
Okay, so that means there might be many solutions to the problem, but you have to tone down to pick the ones that you can work with.
Yes, because remember, you can't do everything. And that's why we start from, even in your strategy process, you're going to be doing your things like your SWOT. So you're checking your capacity to deal with which ones, what current capacities do you have. Also, it's a measure of which one do you even determine you want to focus your energy on as an organization. Out of these three things, one organization might just decide that they will only ever focus on distribution of mosquito treated nets. Another NGO might decide that I'm going to be solely focused on information and enlightenment to rural communities or generally grassroots communities around malaria prevention and treatment. Another one might decide I'm just going to do advocacy. But some other organization might say I'm always going to do the comprehensive three. Because if I do these three things simultaneously, I'm ensuring holistically that the outcomes that I'm seeking are reasonably, I can reasonably expect them to happen. But if I only do mosquito treated nets and I'm not doing information enlightenment, people will still engage in, self-compromising behaviors and things like that. So it's up to this organization founder to decide, yes, which specific ones will reasonably give you the impact. Remember, you're moving from a position of the vision you see of the world to what activities need to happen for that vision to materialize. Yeah.
Okay, viewers, there you have it. It's been a lot. It's always a lot on this show. So I hope you've learned something. Don't forget to send us your questions and your comments so that at least we can react them just the way we reacted to, some of the questions that we had from the last episode. So keep rolling in your questions. And don't forget to like our podcast, share with your friends and family, especially professionals who would gain a lot from it. So like, share, and don't forget that bell that says subscribe.
Bye.